So the 407 randomized phase 3 trial already demonstrated an advantage in terms of overall survival and progression-free survival for pembrolizumab plus chemotherapy versus placebo plus chemotherapy in untreated squamous advanced non-small cell lung cancer. And during this meeting, we got the presentation on 5-year follow-up data, so a long-term follow-up data, and we saw a sort of confirmation of the advantage of pembro plus chemo in this group of patients. What we have seen before is the publication on JTO in 2020 with a follow-up around 15 months and an advantage in terms of OS with an hazard ratio of 0.71. During this meeting, the follow-up time is near to 5 years, and there is still an advantage for pembro plus chemo, even if the crossover of the patient is around 51%. That means that those patients in pembro plus chemo crossed on study and out of the study to receive pembrolizumab. Despite this high percentage, the difference in terms of overall survival is still there, and the hazard ratio is 0.71. And another important thing is the 5-year overall survival data. We have quite a doubled rate in the pembro plus chemo arm versus those treated with placebo plus chemo. One further data that I would like to underline is regarding those patients who receive 35 cycles of pembrolizumab, so a long treatment with mono immunotherapy. And for those patients, there is an higher response rate and an higher 3-year overall survival time. Those are patients in which we have maybe to invest more and to know more also from a research point of view. No safety issue, or let's say no news about the safety compared to the data that we already know from 407. Also for those patients receiving a long-term mono-IO, no safety issue and no news mainly about the immuno-related adverse events, no difference from what we already know from this combination. I believe that this is a confirmation of what we know, that is in the patient with advanced squamous non-small cell lung cancer, the treatment and the standard of care is the combination of pembrolizumab plus chemotherapy regardless of the PD-L1 expression.